Have you ever felt certain something bad was going to happen, only to realize later it never did? When your mind says, "What if?" do you stop to ask, "But how likely is that really?" Or do you assume the worst must be true? Welcome back to Quieting Anxiety. I'm Dr. Monica Frank, and in today's episode, we're beginning a series of episodes focused on advanced cognitive techniques. Practical tools that can help you go even deeper into changing anxious thinking patterns. If you're new to this podcast, I urge you to listen to the episodes in order. They build on one another, and the more advanced techniques we're covering now rely on skills introduced earlier. Let's begin with a short grounding practice. Take a slow, steady breath in and exhale gently. Let your shoulders drop. Feel the support beneath you. Now bring your attention to your thoughts, not to stop them or get caught in them, but just to notice. If any what-ifs show up, you don't need to chase them. Just see them as they are, thoughts, not facts. You might say silently to yourself, "Not everything my mind predicts is likely to happen." Allow that idea to rest in your awareness as we begin today's episode. You've already learned how to identify irrational thoughts and gently challenge them using mindfulness and basic cognitive techniques. But now we're going to take that one step further. Today's episode will focus on probability assessment, a powerful tool for recognizing when your brain is reacting to something that feels dangerous, even when it's not very likely. The methods of advanced cognitive restructuring, and especially the behavioral techniques like exposure, are designed to intentionally increase your anxiety at first. That may sound counterintuitive, but it's a crucial part of the process. You're not doing it to suffer. You're doing it to practice using your foundational skills, like mindfulness, relaxation, and cognitive reframing, while experiencing anxiety. This creates real-world learning. It helps you retrain your brain to recognize that discomfort doesn't mean danger, and that you can stay present and manage anxious thoughts and sensations rather than avoid them. The short-term increase in anxiety leads to long-term emotional resilience. Many of the advanced cognitive methods we'll explore in the next few episodes involve a more direct engagement with anxious thoughts. But this isn't about ruminating. These strategies are based on combining what you've already learned in mindfulness and cognitive restructuring, especially the ability to be with the uncomfortable thoughts rather than avoid them. Why is that important? Because people with anxiety often believe, if I think about my anxiety, I'll make it worse. In some ways, that can be true. If you're worrying about anxiety, you might indeed increase your distress. But examining anxiety is not the same as worrying about it. When using these methods, you may have increased anxiety because you are having to bring the anxiety more to your awareness and examine it directly. That is why these methods are best used after you have learned the relaxation, mindfulness, and initial cognitive restructuring. And that's exactly what we're going to do in this episode. Examine the truth of your fears, starting with how likely they are. Many fears are based on what's possible, not what's probable. And that distinction makes all the difference. For example, right now, a meteorite could crash through my roof. That's a theoretical possibility. But is it probable? Not at all. And because I know the actual probability is low, I don't spend my day worrying about it. Yet that's what many people with anxiety do every day. They worry about things that are technically possible, but statistically improbable. Are things that have a low probability, but are not likely to occur. That kind of thinking fuels anxiety and drains emotional energy. Let's take another example. Flying versus driving. We know that flying is far safer, yet more people fear planes than cars. Why? Because it feels less safe, even when the data says otherwise. That's not to say driving is unsafe, because being harmed while riding in a car is still a low probability event. It's just flying is safer. This is why learning to assess actual probability, not felt probability, is so crucial. Your feelings reflect something real. They tell you what matters to you or that something feels off. But they don't always reflect the facts of a situation. That's why we need both emotion and logic. When you're anxious, your mind tends to blur the line between possibility and probability. Something could happen, so you may respond as if it will. But the reality is, just because something is possible doesn't mean it's probable. And this confusion drives much of our anxiety. Here's an example. Let's say you're giving a presentation and the thought pops up, what if I freeze and everyone thinks I'm incompetent? Now, is it possible you'll stumble on your words? Of course. Everyone does sometimes. But how probable is it that this one moment will ruin your reputation, that everyone will judge you harshly, or that you'll never recover from the embarrassment? How likely is that? When you pause to ask that question, you shift the focus from emotion to evidence. And that's the beginning of probability thinking. But probability assessment isn't always easy. The anxious brain doesn't wait around for facts. It jumps to conclusions. That's why this technique requires slowing down, noticing the thought, and then evaluating the likelihood. Let's break this process down into a few simple steps. First, identify the feared outcome. What exactly are you afraid will happen? Be specific. Anxiety loves vagueness because it makes the fear feel bigger. Then ask yourself, how likely is this really? Not, is it possible, but is it likely? What's the actual probability? Next, look for evidence. Have you ever experienced this outcome before? How often? How did it actually turn out? In addition, consider alternatives. What else could happen? Are there more neutral or even positive outcomes? Finally, adjust your response. Once you've recalibrated the threat level, how might you respond differently, with less fear and more confidence? Let's take a common example, health anxiety. Maybe you feel a flutter in your chest and immediately think, what if I'm having a heart attack? But before jumping to conclusions, apply the steps. What exactly is the fear? That I'm in danger and need emergency care. How likely is that? I'm under 40, have no cardiac history, and just drank 2 espressos. What's the evidence? This has happened before and turned out to be anxiety. What else could be true? It could be caffeine, stress, or lack of sleep. How can I respond? I can monitor the symptoms, do some slow breathing, and see if it passes before reacting. This is how you begin to take control, not by eliminating fear entirely, but by training your mind to respond with logic instead of emotion. If the probability of something bad happening is genuinely high, then yes, you may need to take action to reduce risk or prepare for a situation. But if you determine that the likelihood is low, the next step is to help your emotional brain catch up to what your logical mind already knows. And that takes consistent repetition and experience, not just words. It's not enough to tell yourself this is just anxiety, not a heart attack, once or twice, especially when your body is in panic mode. You have to train your emotional self over time by repeatedly challenging the irrational fear, even when you're not anxious. That's how belief starts to shift. Sometimes you won't know the probability. In that case, it's okay to seek information. Ask trusted people, read reputable sources, or talk with a professional. Just be careful not to fall into the trap of reassurance seeking or compulsively Googling symptoms. Now you might be thinking, but I can't know for sure. What if I'm wrong? And that's true. The goal is not to eliminate all uncertainty. It's to increase your tolerance for uncertainty while improving your ability to assess risk realistically. We're never 100% certain. But the goal isn't certainty, it's perspective. If you spend your life reacting to the least likely outcomes, you'll wear out. Your nervous system will stay on high alert, and that just reinforces the anxiety cycle. By learning to think in terms of probability instead of possibility, you start to shrink that cycle. You begin to train your brain to think more like a scientist, gathering data, testing assumptions, and drawing conclusions based on what's most likely, not what's most frightening. And our thoughts don't always play fair when it comes to assessing probability. People with anxiety often struggle with a distorted belief like, if it can happen, it will happen to me. This kind of thinking equates possibility with certainty. For instance, you might read that a medication has a 1% chance of causing a rare side effect. And instead of recognizing that as a very low risk, you zero in on it, convinced you'll be that 1 in 100. The fear hijacks your rational mind and locks on to the worst case scenario, ignoring the far greater likelihood that everything will be fine. This distortion happens because anxious thinking tends to magnify risk and personalize danger. You might tell yourself, sure, it's rare, but I always have bad luck. Or, just my luck, I'll be the exception. These beliefs are emotional, not logical, but they feel convincing. And when your brain is flooded with anxiety, it treats those feelings like facts. That's why practicing probability assessment is so important. It helps you step back from your automatic thoughts and ask, what's the actual likelihood of this happening? Not just how scary it feels. For that reason, these methods work best when you've already developed a foundation in mindfulness and basic CBT. If you've practiced observing your thoughts without judgment, you'll be better able to examine your fears without being overwhelmed by them. Avoiding anxious thoughts may feel like relief in the short term, but it creates long-term confusion. If you never look closely at your fears, you never get to test them. That's why these next episodes ask you to bring your attention toward discomfort, not away from it. This is also why exposure techniques can be so powerful. They allow you to prove to yourself, through lived experience, that feared outcomes are less likely than they feel. Yes, this can temporarily increase your anxiety, but it's part of the healing process. Just like physical therapy after an injury can be painful at first, but necessary for full recovery. With practice, you'll develop the ability to calmly assess irrational beliefs, tolerate discomfort, and shift your thinking from what if to how likely. Let's end with this reflection. What's one fear I've been treating as probable when it's really just possible? Write it down, then ask yourself, what evidence do I have that this is likely to happen? And what evidence do I have that it's not? Your task this week is to practice this with one fear. Don't try to change it, just assess it. Notice the difference between possibility and probability. And when your feelings try to override your logic, gently bring yourself back to the evidence. You're not pushing the fear away, you're learning to see it clearly. You can use the companion audio, Noticing, Not Believing, a mindful approach to anxious predictions, to help strengthen this practice. And be sure to continue practicing the other skills that have been helpful to you. Let's take a moment to close with a simple reflective practice. Bring to mind a worry or prediction your mind has offered recently, something that felt certain in the moment. Now gently ask yourself, is this fear based on possibility or probability? Take a breath. Feel the space between the thought and your reaction to it. Silently repeat, this is just a thought, not a probability. I can be curious, not afraid. Let that curiosity support you, reminding you that your thoughts are not commands and your fears are not always facts. When you're ready, return your awareness to your surroundings and carry this mindful space with you into the rest of your day. You're building something powerful. Each time you question a fear instead of following it, you strengthen your confidence and resilience. Progress isn't about getting rid of all anxious thoughts. It's about changing how you relate to them, one step at a time. Until next time, keep practicing, keep breathing, and keep moving forward.